Hello guys, welcome to my YouTube channel. Today I want to talk one of misuse drug. This is sildenafil or Viagra. People use it in order when doing it will prolong their time duration to take like an hour. All that's a misuse one. Let's see what sildenafil is used. It's called sildenafil citrate tablet. This is the blue pill. People misuse it. Men use it in order to look energetic, doing for some 30 minutes, or to boost their ego, or to show themselves that they are the strongest man. Let's see what it's used for beside what people use. This is the sildenafil, the blue pill. It's called sildenafil. Mode of action. It's an oral therapy for erectile dysfunction. So it's used for people who have erectile dysfunction. Not everyone that doesn't have even erectile dysfunction. It's an oral therapy for erectile dysfunction which restores impaired erectile function by increasing blood flow to the penis, resulting in a natural response to sexual stimulation. So one thing, it increases blood circulation so that the penis responds to natural stimulation. So anyone who have erectile dysfunction, the one who is using, who should use, not anyone. You don't have any erectile, but you want to boost your duration. Not really. So erectile dysfunction. The other thing I want to talk about mode of action. We know that it increases blood circulation to the penis so that it responds to a stimulation. I don't want to talk about the absorption or distribution of that metabolism, elimination, pharmacological and special patient group. People maybe who might have an erectile dysfunction that can use this drug. 1. Elderly. Healthy elderly volunteer 65 years or over had reduced clearance of serotonin with free plasma. Also people with renal insufficiency, hepatic insufficiency, all that. People who use the drug, the indication is for erectile dysfunction. Okay, this is something important. Dosage, tablet alcohol, oral. In adult, you can use 50 milligram to 100 milligram. In elderly, because we say clearance is reduced, and people with hepatic problem or renal problem sufficiency. Recommendation is 15 milligram taken as in elderly. Since serotonin clearance is reduced in elderly patient, first dose 25 milligram in elderly, because we say clearance is reduced, serotonin should be considered based on efficiency and tolerance. So 25 milligram in normal adult, 50 milligram, and the indication is erectile dysfunction. So what else used in patient using the medication? Let's see the contraindication. One is hypersensitivity. The other effect is sildenafil has shown potential the hypertension effect of acute and chronic nitrate, and it's administered with nitric oxide. If you give sildenafil with nitric oxide, it will start hypertension. Okay, what else is important? Warning or precaution. Although medication history and physical examination should be undertaken to diagnose erectile dysfunction, determining potential underlying cause and identifying appropriate treatment. Before you give this drug, you should identify, you should do physical examination and all that to identify erectile dysfunction. But these drugs in group of PDEF inhibitors. What else important? Other